People knew a COVID crackdown was coming in Scotland.
Everybody's talking about another lockdown. I feel so it's going to be, aye.
Probably something to do with restaurants and pubs.
Pubs are going to be shutting early.
And so it was that at Max's Bar in Glasgow, they watched the UK's most severe restrictions yet unveiled. Nicola Sturgeon warning infections would match the March peak by the end of the month unless she took action. Pubs and hospitality about to be hit hard.
They are intended to be short, sharp action to arrest a worrying increase in infection. Although they are temporary, though, they are needed. Without them, there is a very real risk, Presiding Officer, that the virus will run out of control by the end of this month.
Well, these strict new rules mean that for most of Scotland, cafes, restaurants, pubs won't be able to serve alcohol indoors at all. They'll have to shut indoors at 6 p.m. But they will be able to serve alcohol outside until 10 p.m. Except here in Glasgow and 4 other parts of the Central Belt. It's going to be really strict here. They're going to have to shut all licensed venues, indoors and out, entirely, except for takeaway.
Why? The Scottish Government published evidence that 1 in 5 contacted by Test and Trace said they'd visited a pub, restaurant or cafe. The Scottish Hospitality Group called it a death sentence for businesses. In Max's Bar, they're forlorn.
For me, I just don't understand it, because with the measures that we have in place here, we are keeping people safer than they would be in their own homes.
It's choking us. Absolutely choking us. Is there going to be more government support during this lockdown?
Nicola Sturgeon said there would be £40 million of support available.
The hospitality industry and the nightlife industry in particular has been left to rot by Westminster more so than the Scottish Government, but they don't have the resources to keep people that are in jobs that work in bars being paid via things like furlough and whatnot.
It's not been a good day for the pub trade. Greene King announced 800 job losses, 79 pub closures, citing the 10 p.m. curfew and the winding down of the furlough scheme. Today's restrictions may seem tough on parts of Scotland with low or even zero infection rates. In places like Rutherglen in South Lanarkshire, they also invite questions about whether existing local restrictions have worked.
Now, this area was put under extra local restrictions almost a month ago. Glasgow, down the road, had them imposed 5 weeks ago, and these restrictions were supposed to get the virus under control. And yet, despite weeks under these extra measures, cases here just keep rising and rising. And these areas now have among the highest concentration of coronavirus in the whole of Scotland.
Throughout this changing landscape of COVID rules, Scotland has often preempted the rest of the UK. Could pub and hospitality closures follow across the north of England, where the virus rates in places are higher still? Ministers are said to be discussing next steps. At PMQs, the leader of the opposition wondered if local lockdowns were working.
So will he level with the people of Bury, Burnley and Bolton and tell them what does he actually think the problem is here?
What we are doing is a combination of national and local measures, which 1 week, Mr. Speaker, he comes to this House and supports, and the next week, mysteriously, he decides to whisk his support away.
In Scotland, across much of the Central Belt, pubs and restaurants will close at 6 p.m. on Friday for at least 16 days. As Nicola Sturgeon bets on a virus reset, she hopes will do more good than harm.
Nicola Sturgeon says this is not a full lockdown, but a 6 p.m. cut-off for indoor dining is clearly going to worry businesses. There won't be too many takers for sitting outdoors in a Scottish October. And as for these 5 areas, including Glasgow and Edinburgh, under even stricter measures, as well as closing all these pubs and restaurants entirely for 16 days, people have been asked not to take public transport and not to leave the region if possible. And all this is the nearest thing yet to a so-called circuit breaker in the UK. It coincides with school holidays across much of Scotland, and the intention is to try and get a hold of this virus before things get much worse. Now, those querying these measures say, well, there was only 1 new death announced in Scotland today. but Nicola Sturgeon says the alternative is to allow the virus to get out of control. And just one more big decision to tell you about in Scotland today. You'll remember the exam results fiasco. Well, the Scottish Government has tried to avoid a repeat of that mess. Next year, it's announced it's cancelling one set of exams. The National 5 exams, roughly the equivalent of GCSEs, have been called off altogether.
Kieran, thanks very much. Now, tighter restrictions could be coming soon for the city of Nottingham as coronavirus infection rates have risen sharply there. The rising numbers appear to coincide with the arrival of hundreds of students for the new university term. So has that worsening health situation created tension between the permanent residents and the student population? Our Home Affairs correspondent Darshna Soni has been finding out.
Making the most of the sunshine today in another city on the brink of another local lockdown. Nottingham has seen its infection rate jump from the end of September, from around 59 per 100,000 to 382 per 100,000, a jump that coincided with this. 2 weeks ago, we filmed with students here on their Freshers' Week as the 10 o'clock curfew for pubs and restaurants was introduced across England.
10 o'clock, that's not the end of the night for most people.
Since then, students have been asked to moderate their behaviour and told they face disciplinary action if they break social distancing rules. The University of Nottingham has confirmed 425 positive cases. There are 2 universities here with a total of around 45,000 students. But are they to blame for the increase in cases? Jack is studying sports science at Nottingham Trent.
I don't think it's fair. You had like the eat out to help out thing. They're kind of trying to push us to go back to work, go back to uni and to go back to normal basically. And then obviously now we come back and we're kind of being blamed.
It's not just the students to blame, absolutely. I work in hospitality, so I've seen it from everyone.
Like many cities, Nottingham has always welcomed students. Its economy relies on them.
Here we go, gents. Welcome back.
Jason Loftus manages an independent coffee shop in the city centre and says he's not sure they could survive further local restrictions.
A lot of people are blaming students in Nottingham for the rise in cases, but businesses like yours depend on them.
Yes, you know, for students, we look forward to the students coming back over their terms every year because it changes radically the landscape of Nottingham, business-wise. You know, it's a lot more disposable income, a lot more custom, a lot more diverse custom, international custom, and that's all represented in the student body. Now, without them, we are kind of lost.
But not all of Mr Loftus's customers agree.
I'm complaining there's no makeup lady.
You don't need makeup.
Pensioners Terry and Norman are regulars. They're not too impressed with stories of late-night parties in halls of residence.
If they want to party, they can go on an island somewhere or go somewhere else and do the party in a big field.
It's not just Nottingham, of course. University cities across the country have seen a spike in cases, leading to a resentment in some places between town and gown. Critics are asking why the government didn't predict the consequences of allowing the mass migration of thousands of students.
Across Manchester, 2,000 students have now tested positive. Hundreds are having to self-isolate and all teaching has been moved online. There have also been outbreaks in Sheffield, Newcastle, Exeter and Oxford, where 70% of positive cases were amongst students in the last week of September.
Why should they all come back when all this is still carrying on? It's just stupid, you know? It's just, they're bringing them in too early.
Nottingham was not on the government's original COVID watch list, but now residents here and in other university cities have been warned to expect an announcement on further restrictions in the coming days. Darshna Soni, Channel 4 News.
Now, thousands of scientists from across the world have written an open letter calling for an end to blanket lockdown restrictions, saying that restrictions should be targeted to protect vulnerable people. And what's been called the Great Barrington Declaration, because of the place it was signed, may have revealed the great scientific divide, with many experts arguing the letter is simply wrong. We'll hear from one of the signatories in a minute. But first, Devi Sridhar, who's Professor of Global Public Health at Edinburgh University and an advisor to the Scottish Government. I talked to her earlier, and I began by asking her whether sobriety is really one of the answers to defeating the virus.
I mean, I guess the issue is that alcohol makes it more difficult to put in place the kind of regulations you need around distancing, around making sure you're not having households mixing, and especially late at night, these break down. And this is looking at international experience, what other places have done. When you're actually going to implement restrictions, many of them start with alcohol, with nighttime life, such as discos, clubs, bars, and pubs.
But frankly, what's the science behind 16 days? Why not a month? Why not 2 months? Why not 14 days? Why 16 days?
Well, the idea is to go short and sharp to break the chains of transmission. Scotland was doing exceptionally well in the summer, but then we had summer holiday season, tourism season, a few weeks later, universities going back, and then new chains of transmission being taking off across the country. And the two places tracing teams are seeing this arising from are from hospitality and from house parties. So the idea is to go short and sharp, and so we can get back the testing and tracing in place to be able to really be in a better position at the end of those 16 days.
And do you think there's anything else that the Scottish Government needs to do in the next 16 days while this restriction is put on restaurants and pubs in order to prevent the spike from continuing?
Well, I think the two things that are really important is first is to enhance the testing and to get, mobile testing units into the central belt to try to identify as many cases and try to break those chains. And not just the testing and the tracing, but the isolating to try to figure out how many people are actually doing that 14-day isolation. What are the incentives, the further incentives people need to be able to be supported to do that? And the second is really take a hard look at universities.
OK, let me put the Great Barrington Declaration to you. Let me just read a quote from the declaration. The most compassionate approach that balances the risks and benefits of reaching herd immunity is to allow those who are at minimal risk of death to live their lives normally, to build up immunity to the virus through natural infection while better protecting those who are at the highest risk. Do you agree with that declaration?
I do not agree with the declaration because I do not think it is scientific or actually accurate. And if we look at the advice of the WHO, of health leaders in the United States, what they come out and say is it's not necessarily possible to build herd immunity to this virus. Many thought, immunity would at least last a year. And at that point, if we still haven't built herd immunity, all we're going to see is cycles, waves of infection.
But this declaration was signed by hundreds of scientists. So why are they getting it wrong and you're getting it right?
Well, I think they haven't thought it through in terms of what it would feasibly mean in different countries. These are really the East Asian countries. And how they're doing it is not through lockdowns. They're having strict border measures to prevent re-importation of the virus. And they're also doing this through a robust test, trace, isolate system. And so I would say that, yes, we might have, hundreds of scientists signing this, but there are absolutely thousands across the world who would disagree with that approach. This sounds great in theory, but if you actually work in practical public health on the front line, it doesn't make much sense.
David Sridhar, thank you very much indeed. Well, one of the academics who signed the Great Barrington Declaration is Professor David Livermore, a medical microbiologist from the University of East Anglia. He joins me now. Thanks for coming on the programme, Professor Livermore. Tell me, good evening. Well, Devi Sridhar, you heard a professor from Edinburgh, said that you were unscientific, it was inaccurate, it wasn't going to work, and it costs lives.
And the present policy of lockdowns, do you think that is succeeding? I would suggest it is merely kicking the can down the road on a gamble that we will get a perfect vaccine when actually it's unlikely we will do so. We will get a vaccine, but that too will only give a very partial protection. And it will be a considerable period before we get such a vaccine. I would have thought well into next year. In the meantime, the economy is severely damaged, the delivery of other healthcare is severely damaged, and people's mental health is severely damaged. It is better that we move towards developing some herd immunity, however incomplete, which gives a protection. In many ways, my view with it is it's no disaster that all these students are catching COVID. Very, very few of them are becoming severely ill, and they will be developing some immunity.
Right. But isn't the point that those students can pass the virus to others in the community who are more vulnerable, who are older, who are already, living relatively sheltered lives, and that the road to partial herd immunity is paved with too many corpses?
I'm unconvinced of that Anybody who feels that they're unwell with COVID or they've been exposed, yes, they should self-isolate or merely stay with other fellow students who have been similarly exposed. They should stay away from older people. And the Great Barrington Declaration also strongly makes the point that those who are vulnerable should be protected and should be helped to protect. The trouble with the lockdown route is unless there is a perfect vaccine, there is no way out. It is merely kicking the can down the road.
But there are 4 million people in this country, roughly, who are having to shield for various different reasons. You're consigning these people to indoors for the foreseeable future. You're creating a class system of those who are locked down and those who are unlocked. Society cannot tolerate that, surely.
Well, society has been impelled to tolerate the entire population being locked down through March and April, with the economy stalled, a 20% reduction in GDP. Surely it is better that a proportion protect themselves, and there has to be a personal judgment of risk here, rather than everything being closed down, tax revenues collapsing, business activity collapsing, and such a disruption of society.
But we don't even have a test and trace system that works. I mean, we're basically having to make it up as we go along. And the danger, again, with your approach, is that too many lives will be lost down the road.
I'm not convinced that a vastly greater number of lives will be lost. By the time you add together the direct lives lost through COVID and the indirect losses through people failing or being unable to access healthcare, delayed cancer diagnosis, and so on and so forth, if you look on a 2 or 3 year view, I suspect it will not come out too much differently. One can look, for example, at Sweden. And Sweden, as well, had a much lighter regime through March and April than we did, and yet the per capita deaths were actually a little bit lower. And that includes similarly crowded cities like Stockholm and Gothenburg and Malmo. A lot of the Swedish deaths, as with ours, were in care homes, and in both our country and in Sweden, there was a failure to adequately protect people in care homes. And that is a tragedy, and both of us could have done a lot better there. But the overall down, the UK left us poorer than the Swedes, but no better off in terms of community deaths.
OK, got to leave it there. Professor David Livermore, thank you very much for coming on the programme.